I hope that you can hear me. Okay. So perhaps we start. Honorable Monica Garcia, Minister of Health, distinguished speakers, colleagues and guests who have joined our meeting, it is my pleasure to welcome everyone at this event. My name is Julia Salacu. I work at the World Health Organization on governance and anti-corruption, transparency and accountability in health. Today I will be chairing this meeting, which will discuss how anti-corruption mechanisms can support more equitable and efficient health systems. Firstly, I would like to thank our co-hosts, the Ministry of Health in Spain, the European Observatory on Health Systems and Policies, the World Health Organization Office for Europe and headquarters. It is undeniable that corruption undermines health systems and people's right to health. Also, the COVID-19 pandemic has magnified the risk of corruption across all countries' health systems. But what can we do about it? And while traditionally it is common to look at the detection and punitive aspects, can prevention mechanisms provide a more effective lens to combat this problem? In the next hours, our speakers will illuminate on these issues and provide a multifaceted approach to effective strategies to close off opportunities for corruption in areas such as transparency, accountability, legislation and regulatory oversight, capacity building, incentives and technological innovation. As we have quite a full program, I would like to turn to our first opening remarks, who are given by the Honorable Minister of Health, Monica Garcia. Thank you.
Thank you very much. Bueno, thank you here, and it's an honor for me to start this meeting. Voy a hablar en español.
I'm going to speak in Spanish. Thank you so much, Julia. Thank you so much, David. Matthias, and of course also Giuseppe. Thank you very much. Thank you so much for organizing this and for joining us in this event. It's a real honor for me to be here today because this is one of the topics that have really concerned me throughout my professional life, and now as a minister even more so. And so we're delighted that this Ministry of Health has been able to co-host this high-level seminar on corruption in health systems. I would like to particularly thank the Health System Governance and Stewardship Unit of the WHO, as well as the European Observatory on Health Systems and Policies, which have made it possible for us to hold this seminar here today. I also want to thank all the speakers who are joining us today. Corruption in health systems has always been a topic of enormous interest for me, particularly because in many countries in Europe and globally, it is something that is, I think, well understood and addressed, and yet here in Spain, it seems to be quite an invisible problem because we confuse, amongst other things, individual corruption, corruption which is connected to a particular crime, to institutional corruption, which perverts and degrades our healthcare systems. And so in this ministry, we're going to work not just internally to bring this topic to the light and to make it visible within our sphere, but also to look beyond our country and learn from best practices internationally. So I'm sure that this seminar is going to be a great opportunity to get this process started, to get this discussion started on effective strategies to deal with this challenge which affects our national health systems and the integrity of that health system. Because I'm sure that you will have heard me say often that our national health system is the jewel in the crown of our administration. And a journalist recently, Juan Luz Sanchez, said something quite rightly, which is that two things can happen with jewelries. You can either protect them or you sell them. And our role here is to protect that jewel And some, however, are determined to sell them in parts or as a whole. And so in this intention to protect our health system from these bad practices, which end up selling this jewel in our crown, one of the steps is this seminar. And I think that every form of corruption is completely unacceptable, but corruption in the health system is doubly so, because they're not just stealing the taxpayers' money, but they're also stealing our health, which is our most precious possession. So they're not just putting their hand in the till of our shared treasury, but also dipping their hands into an intensive care bed, into research of a rare disease, or even the waiting time for a patient who's on a waiting list because there aren't enough resources. So it's illegally transferring funds which should be going to healthcare and protection towards vested interests, which are having a negative impact on our collective health. And in the last months and weeks, and as you quite rightly said, also since the COVID-19 pandemic, I think that has also increased the visibility of this problem. Here in Spain, we have heard of absolutely horrifying cases of this nature, some quite blatant, and also dealt with quite a lot of impunity, because here it seems people connect corruption with one particular individual eventually being prosecuted for a particular crime. But what we're talking about is something that is actually a lot more common and widespread and abstract in a way. But at the same time, it's what's having the greatest impact on our health systems, which is that sort of institutional corruption. And we've seen all kinds of examples here. Lately, we've also seen some of those revolving doors, which are not even revolving. They are, I say, revolving parasites of our health system, which are drawing out the lifeblood of our precious health system to spend it on luxury goods or real estate or holidays. And so that's why the national public health care system must act as guarantor of the health of our citizens, and therefore must become involved in these cases, preventing them and investigating them and getting them prosecuted. While some are watching over their private for-profit businesses, what we must do is to watch over the health of all of our citizens. And that's why I'm proud to say that the Observatory Against Corruption and Fraud in the Health System is already operational. It's already a reality. And this is not about finger pointing. It's about never again. It's about never again having anyone put their hand in the till of the common healthcare system of all citizens. And so with this observatory, we're just going to investigate and identify all those fraudulent, illegal behaviors which are having a negative impact on our health and our health system and our democracy, because their impact actually goes well beyond the fact of somebody filling their pockets with our taxpayers' money. And there are many things that we can do, and we're going to hear about these approaches today. But basically, as Susie said at the beginning, we're going to talk about prevention, also about an early warning system, and also, thirdly, about partnership with different institutions working in this field. So we're going to talk about cooperation to promote transparency, full disclosure, and this is, of course, very significant in the area of public procurement in particular. And secondly, an early warning system to see which areas might be those areas where we might have to focus in order to prevent these cases of fraud and corruption. And thirdly, it's cooperation with different institutions, both national and international, where we can share and exchange these best practices and these guidelines. I'd also like to give you an example of each of these three aspects so that we all know what we're talking about. And the first has to do with prevention, and it's about preparing a code of bad practices. I mean, in the clinical setting, we have these not-to-do guidelines, so manuals, and something we always say in medicine, which is above all, do no harm. And in public procurement, of course, again, above all, do no harm, do prevent all those practices in public procurement, in public tenders, which are areas where we know might be fertile ground for fraud and corruption. And secondly, let's create a risk map in the national health system so we can identify those critical points where corruption and fraud in our health systems flourish. And thirdly, let's develop a protocol of cooperation with national and international organizations which already have responsibilities in this area in various health systems. So overall, the government of Spain is strongly committed with shedding light on those parts of our health system which are perhaps more opaque or more reactive to fraud and corruption. And that's important because it's not just the health of our citizens that's at stake. It's also the trust in our public institutions and in our national health system that's at stake. And so our work will always be driven by focus and cooperation, but also evidence, because there's a lot of evidence already on health corruption. There's a lot of places, a lot of research, there's a lot of papers that have been published on corruption in health systems. And from this ministry, we're always going to be working with an evidence base. And so hand in hand with the best experts and the best organizations and with our mission of public service, which I think we share both within and beyond our borders. And to close, I'd just like to thank the organizers and the speakers and everyone here for your efforts and your dedication and your input. And I hope that this event will help to take us one step further in this fight against fraud and corruption in health systems. Thank you.
Thank you, Your Honorable Minister. As you well said, it's a lot is written about the topic, but what we need is actions. And really congratulations on launching the Observatory on Health Systems Corruption, and best wishes with that. I would now turn to the next speaker, Mr. David Clark, Unit Head of Health Systems Governance and Stewardship from the World Health Organization.
Thank you, Minister. So, Minister, we would like to congratulate you on taking this important step of setting up the observatory. We think it's very important. At WHO, we're a health agency, and you might wonder why we're working on corruption. I mean, about 10 years ago we weren't, but we've realized that this is a very important area of our governance work, our systems governance work, emphasizing what the Minister was saying, that it's not just about individuals who are taking money out of the system, it's about making sure the system itself is designed in such a way that we minimize the risk of corruption. And why are we really interested in this topic? I think it's very important to remember that all health systems are susceptible to corruption. Often we have a conversation about corruption and we think about health systems in countries with less resources. But I think what the COVID pandemic has shown us is that all health systems are susceptible to corruption. We've seen all these terrible situations in the European context where we have all these resources that were diverted from the pandemic. And I think perhaps we've become a little bit complacent. So what we want to emphasize in our work at WHO is the importance of making sure that the institutional aspects of health systems are well designed to make sure that we don't have these problems. I think often you see these problems of corruption arising when you have reforms or when you have changes, and perhaps then when you are making these changes, you not necessarily have thought about how to design in new kind of controls and practices to make sure that corruption is not a problem. I just wanted to just to read two quotes. So corruption's been an issue for the United Nations for ages. It's something that's part of the SDG agenda. And I just wanted to read a couple of quotes. The first is in 2021, there was a special session of the UN General Assembly about corruption. Not specific to health, but corruption in general. It talked about the necessity of implementing measures to prevent and combat corruption and to strengthen international cooperation to do so. So there's a strong political imperative to work on this topic. And member states expressed concerns about the negative impact of all forms of corruption, including the solicitation of undue advantages and how that can negatively impact on public services, on the enjoyment of human rights, and recognise in particular that it exasperates poverty and inequality. It's often those who are furthest behind who are most affected by corruption. And of course, last year we had the UN high-level meeting on universal health coverage, and during that meeting, very interestingly, member states again recognised that fighting corruption at all levels is a priority, and that corruption is a serious barrier to effective resource mobilisation and allocation, and diverts resources away from activities that are vital for poverty eradication and sustainable development. And also very mindful of the examples the Minister gave in her speech. This isn't a victimless crime, it's something that takes resources away from health systems. And for me, this is incredibly important, because in a world where the resources that are available for health systems is increasingly constrained, we need to make sure that we maintain and treasure those resources highly, and that consequently we need to do something about corruption. We don't have up-to-date figures on the cost of corruption. I think the figures that we have are about 10 years old now. But in 2011, there was an estimate that 56 billion euros were lost in the European Union to corruption. And there was a global estimate a few years ago that said that 6% of global health expenditures are lost to corruption. I think those estimates are probably quite low. So this year, we're going to have a look at updating those estimates. I think it's very important that we are particularly pay particular attention to these estimates and to these costs. But I just wanted to finish by saying that what we want to do today is not just talk about the problem, but also to talk about solutions. I think that this is a difficult topic to talk about. I was talking to Julia the other day, and she made the point to me that this is a topic that's a bit stigmatized. It's not something that you can talk about openly, and I think we need to. And for WHO, it's really, and I've just given the Minister a couple of books that we've written. For WHO, it's about making sure that anti-corruption thinking is integrated into all sorts of health systems work, whether that's planning or working on health workforce regulation or working on procurement. It's incredibly important that we bring these kind of these perspectives into this work. And I just wanted to end by saying that WHO is a health agency. We're not an anti-corruption agency, and so that's why we take a prevention approach to corruption, to think about a public health approach. And what I mean by that is we've taken public health approaches to many different topics, like alcohol and violence. So equally, we want to take a public health approach to corruption, really trying to understand well what are the root causes of the problem, and I'm sure that the observatory in Spain will be a great resource for this, and then trying to work out, based on evidence, what are going to be the best solutions for dealing with it. And if we take this kind of approach, we can get away from stigma, we can get away from politics, and we can work on this topic as a technical problem as part of our work to strengthen health systems. So in closing, I'd just like to again commend the Minister and the Ministry for setting up the observatory, and we look forward to working with you and going forward to help make this a big success in Spain. Thank you.
David. Now I would like to turn over to Matthias Wismar, who is Program Manager at the European Observatory on Health Systems and Policies, and he will introduce us the objective and content of this seminar.
Dear Minister, colleagues, friends, online audience, I think it's fair to say that COVID-19 has laid bare deficiencies of our health systems, and one of them is corruption, obviously. Almost in all European countries, we've seen high-profile cases of corruption, mostly in procurement that was very, very visible, personal protective equipment, masks that wouldn't fit, but also sometimes whole service packages which were fraudulent and were never delivered or delivered in a quality which was not acceptable. But corruption is nothing new, and as the Minister said, it has so many forms. It's not just the procurement, not just the high-profile cases. We have absenteeism, diversion of patient to private facilities, procurement irregularities, informal payments, just to name a few. There are many, many more cases than this. And as we have heard, probably there are no current figures, but it's quite big, actually, you know. It's not negligent. It's really, really very important, and it diverts a lot of resources from helping people in really dire situations. So today, we are here to discuss what are actually good strategies to prevent, to tackle corruptions in countries, knowing very well that corruption is mostly inbuilt in our systems. It's a question of system design, actually, and as our systems vary, the corruption profile of countries may vary, but still, we firmly believe that this meeting, if not kicking off, so intensified, helps to intensify a debate in the European region between countries, you know, that we learn from each other, that we benchmark each other, that we look at best practice examples, how to tackle actually examples, and that we connect ministries and competent authorities. So we hope this is a meeting with outcomes, and I'm looking at Dave, I'm looking at Joseph actually, so I think they have something to offer by the end of the meeting. Just to say a couple of words on the program, it's straightforward. We will have a wonderful presentation from David McKee. It's terrible to say wonderful about the topic, but it's a wonderful presentation. I think it will really take us into the topic and will show the whole panorama without being shallow, with really giving you a flavor what's it all about and why it's so important and what can actually be done. And then I'm very happy to announce that we have a panel which will discuss what can actually be done. And I'm so happy to say that we have been able to secure the participation of renowned Spanish and international experts and practitioners in anti-corruption policies and mechanisms. And then after this, we have a quick wrap up and see what are the next steps to do. So that's it from my side. Thank you so much. Thank you, Julia.
Thank you, Matthias. And as you all heard, it's quite an intense program. So I would like to invite our first keynote speaker, Professor Martin McKee, the Research Director at the European Observatory, to provide us some of the biggest concerns about corruption in healthcare in European countries.
Thank you very much, and I hope you will forgive me if I stand with my back to you, because I need to be able to look at the slides, and you may want to come down here if you want to see them. So I have been asked to set the scene for all of this. And what are we actually talking about? What is the subject area that we're interested in? Well, as always, when we're working on corruption, we look to Transparency International, who have done more work on this than anyone else. And they have really been in the forefront of cataloguing, describing, defining, responding to corruption across all sectors. And they define it as the abuse, so doing things that are wrong, of entrusted power. So people must have power to be corrupt. They must have the power to make decisions. They must have been entrusted with that power. They must have been given discretion. So somebody somewhere, politicians, authorities have said to someone, you are making decisions. You've been given our trust to do it properly, but they're doing it for private gain. It's a really important issue, and this has already been said. We wrote a paper, my colleague Dina Balabanova, who will be on the panel later, myself and another colleague, we need to talk about corruption in health systems. And the analogy that we used, because it was at the time after Harvey Weinstein and all of those things, it's something that we all know happens. We know it happens. We've seen it. We recognize it, but we don't talk about it. Or if we do, we talk about it quietly. People know about it, but we do not call it out. So there is a parallel. There are other things too, but there is a parallel there. Transparency International consistently find that the health sector is among the most corrupt in many countries. Now, there are lots of reasons for that. I don't have time to go into them, but it is. As David has already said, the data are old, but one estimate in 2011 that it was responsible for 140,000 child deaths per year. It contributes to antimicrobial resistance, which is one of the greatest threats to humanity. And it's a barrier to achieving universal health coverage, which all of our governments have signed up to do. And here we have their report, The Ignored Pandemic, which is a good overview. So what does it include? And this is where I'm going to run through quite quickly some of the areas. Now, some of the areas I've listed are from a paper that we did with colleagues in West Africa, Corruption in Anglophone West Africa. We reviewed the literature. We identified the main themes. Another paper by Glind, which are in green here, and then another one I added at the end. So I'm going to run through those one by one. Absenteeism. Now, we often don't think about absenteeism, but if we go back to our definition, we trust health workers to turn up for work and stay there. So we have entrusted them with the power to make decisions if they come or they go. And they abuse it for private gain because they do other things. They fail to turn up, they leave late, they turn up late, they come to work but do other things on the internet or whatever, they leave early. Now, just because someone is absent, it doesn't mean they're being corrupt. There could be lots of other reasons, and this is where it gets difficult. So we need to understand their motivations. Work that we're doing is doing exactly that. But it is often not always the fault of the individual. It's often a dysfunctional workplace where nobody cares. But it becomes corrupt when, for example, a health worker is being paid to come to work, but they're actually working somewhere else, and they're paying a bribe to their supervisor. That would be an example of corrupt absenteeism. Absenteeism because a health worker's child is sick and they have to go and look after it, or they're ill, that's not corruption. But there are corrupt manifestations of absenteeism. Dual practice, where people are working in the public sector and in the private sector. Very little research in high-income countries, but we all know it happens. One example from a European country, yes, I've mentioned it, a correlation between the private income of doctors and the waiting lists in their specialities. In other words, the specialities where the waiting lists are longest are the ones where the private income is greatest. There is clearly a great incentive to let the waiting list become long so that you can see people privately. Why do people not just work in the private sector? Well, it's because they get a benefit from working in the public sector. They're boosting their reputations and so on. It's often seen as a victimless offence. And one of the challenges for finance ministries, for health ministries, is that it often reflects the fact that we don't pay our doctors enough. We have to face that's a simple reality. Procurement, the Minister has already mentioned it. Thank you very much for doing that. We published a major report in the European Commission expert panel on public procurement, which I need to send you. And the thing is that hospitals, health facilities procure hundreds of different things, thousands of products. And often the selection criteria are quite opaque. They're difficult to understand. The benefit of one drug over another, the benefit of one supplier over another. And there are so many factors to take into account. One perfectly legitimate factor in procurement is that there is a good rationale for a hospital to procure from small local suppliers because that boosts the local economy, it improves the health of the people, and that's perfectly legitimate. But it has to be done transparently and openly. Problems are even greater. We'll come back to it in the pandemic. Thank you, Minister. And the issue of kickbacks and revolving doors. And I loved your example of the parasites sucking the blood. That was a really nice example. So the reality of it is that the rules are there. And the rules are very flexible. They allow for all sorts of things like taking into account the characteristics of the product, the benefit to the local economy. All of that can be done. Sometimes they're stuck to very rigidly and you get the wrong outcome. But remember that procurement should also be not just about promoting, getting the cheapest product, but getting the best product. And this is particularly a challenge with things like IT systems, where you often procure an IT system which actually doesn't work. I mean, it may be the cheapest, so you need to be a bit careful. But the principle is the most economically advantageous tender. You mentioned it. Yes, the pandemic was a great revelation. I have taken out a lot of slides from what was my original go at putting this presentation together. I can't say what country my examples come from, but there are many of them, and they are listed, many of them, in our European Commission report. And you said about holidays and luxury goods and things like that. Private jets. Don't forget the private jets. Gulfstream G650, absolutely fantastic product. You'd love it. You know, ministers in some countries have, you know, used them for all sorts of things. They use helicopters, they use jets to fly 350 kilometers, whatever. Yeah, why not use them? This is a company that basically had nothing, and it then benefited from the pandemic. Don't believe that everybody suffered in the pandemic. They didn't. Informal payments, again, something we've done lots of work in over the years in many countries. A lot of the research comes from low-income countries, but the research in Europe is largely from Eastern Europe, the former Soviet bloc, but also Greece and Italy. That's where the research is from. It may happen elsewhere. Payments can be in cash or kind, and sometimes the payments in kind are presents that the doctors don't actually want. Dina Balabanova's work has some lovely examples of that because it's so ingrained, the feeling you have to give something to the doctor even when they don't know what to do with it. We have put together, developed a theory which talks about INCSIT. And Hirschman talked about if you're unhappy with a health system, you can either exit it, you can leave it and go to the private sector, or you can use your voice, you can complain about it. If you can't complain, if you can't leave, we talked about informal exit, where you basically pay under the table. So effectively, you're informally exiting the system. You're in the system, in the room, but in the payment, you're outside it, so it's an informal exit. Theft of drugs and supplies, I won't go through this in detail, but there's an awful lot of this going on. And it happened, you know, from the very beginning. Some of you may have seen the absolutely classic film, The Third Man, set in Vienna in the post-war period, where Harry Lime, the villain of the film and of the book by Graham Greene, was trading in penicillin that wasn't working. So, you know, there are examples throughout history in all of this. And that's a taxonomy I've taken from this paper by Dugato and Sidotti of all of the different types of theft of drugs and supplies. Fraudulent financial agreements, well, obviously paid lobbying. I mean, the people who are susceptible are politicians, health service managers, and physicians. And so there can be all sorts of payments, and this is just a framework for looking at it. Fraudulent billing. The real challenge in the medical encounter is that you're acting under conditions of information asymmetry. One side knows much more than the other. And I could look at any of you and I could come up with, you know, is anybody feeling thirsty at the minute? If you're feeling thirsty, then, you know, clearly I need to code you clinically as having electrolyte disturbance because, you know, you got an electrolyte disturbance. And if that actually makes you a little bit more expensive, perfect. Who's going to argue? So this is, again, what I'm largely doing in this is for you to take away and look at later, taxonomies, so you can start to think about things. Upcoding, saying the procedure took longer to take, saying you're using equipment you didn't use. I mean, once the equipment is in the patient, if it's a prosthesis or something, who's going to check? You know, an auditor cannot go and open up the patient's hip to find out what joint they used. So, you know, it's essentially burying the evidence in a way. And you can, unbundling, where you can get more money for saying that a package of care was a whole lot of different things, and then just making it up and saying that you treated patients or saying that you were doing, claiming for complex ones. So that's just like the other slides of taxonomy. I'm throwing this in. This is work that Amira Taran and I did many years ago. Counterfeit medicines, I'm including that because there is a real problem in many countries. The difficulty, and we worked very hard to get any agreement between two groups, the access to medicines community and the pharmaceutical industry. And you would think that they would both want to deal with this, but actually they don't. And one of the problems is that the access to medicines people are concerned about intellectual property. Pharmaceutical industry are also concerned about intellectual property, but in a different way. So getting everybody to agree on this is really difficult. And of course, we want to make sure that we have everybody getting legitimate drugs. There are some drugs which are perfectly legitimate, but they just don't work very well. There are some that are illegally produced, and there are some that are both. And finally, there is a problem in some countries, which I can't name, where a politician might say in a marginal constituency, I will build you a hospital, or even 40 hospitals, and they will promise that they will build a health facility or something like that. We don't often think of that as corruption. I do, because I think that is actually the abuse of entrusted power for private gain. And in that case, it's getting more votes, which I think falls within the definition. So with that, a caveat. We need to be a bit careful. There are governments that will, and politicians, who will charge their opponents with corruption because they find something that just doesn't look quite right, or they make it up. And so we need to be careful that we do not see an abuse of anti-corruption activity. You know, locking up political parties, locking up journalists, whatever. So we do know that there are countries where that happens. So we need to be a little bit careful. The other thing is that sometimes activities that look corrupt are basically the only way to make the system work. So if you are charging patients for the consumables, for the medicines, it may be because that's the only way to get them. So again, just caution, our work in one country in Asia was looking at absenteeism. And you say, well, why are people not going to work? Doctors not going to work? The reality that they weren't going to work was that the facilities were unsafe. They were the victims of sexual and other violence, and you really couldn't blame them. So you just need to be a bit careful. I put up these responses because you'll be using them in the discussion later. I won't go through them now because we don't have time, but there are a whole series of responses that we can adopt. And one final mention, one thing to remember is this is dangerous work. This is risky work because the people who are involved in the high-scale, big-ticket corruption are not nice people. And I think you all know who Daphne Caruana Galizia was, who was murdered for exposing corruption. And I think that is a nice point in which to end, a tribute to somebody who actually gave their life for this cause. Thank you very much.
Thanks very much, Martin. If you want to sit on the panel. You raised thousands of questions, not least from me, but we'll have the opportunity now to debate those. Welcome also those who are online. They have a system, and in the room, through Slido to raise questions, and then later we'll moderate and bring to the panelists. My name is Joseph Figueras. I'm the Director of European Observatory. I'm more than delighted to accept the challenge and the invitation of the Minister a while ago to work on this project together and to trigger a lot of work in future. And you'll be hearing lots of ideas and suggestions from our colleagues in Spain and our colleagues in the WHO headquarters office. As well, today I'm not only as Director of the Observatory, but reflecting and representing as well the Regional Office for Europe, and lots of regards from Hans Kluge, our Regional Director. So you know, the Observatory is a partnership. It's a partnership hosted by WHO with the European Commission and 12 member states of the Western region, the Western Europe, indeed with Spain at its core. Actually, Minister, you may not know, Spain, together with Norway, the World Bank, and WHO started the observatory too many years ago for me to wanting to remember, because I was there. Don't want to reveal my age. But we started thanks to Spain. So thank you very much, and homage to you and to our country for starting in this initiative. So can I ask the panelists to join, please? Dave, you can join. Dina, we'll introduce you as we speak. Please, Sofia and Olga. My co-moderator, Jacobo. So we will do 50-50 kind of sharing, more or less. We'll be co-moderating, we'll be improvising, we'll be asking you questions, some expected, some less expected. And then, as I said, please follow in your Slidos and raise questions there, because my colleagues Matthias Wismar and Julia Salaku already, who met both of them already, will be monitoring and giving us a sense of the kinds of questions and views from our colleagues online. Jacobo, you want to introduce yourself and start?
Yeah, good morning to you all. And to the representatives of the WHO, and of course to other organisms of the Spanish government. Me presento, soy Jacob Fernández Álvarez.
I'm Jacob Fernandez Alvaro, the Technical General Secretary of the department, and I will be co-moderating together with Giuseppe this very interesting panel in which we're also very fortunate to have two of the Spanish representatives of two institutions which will be partnering with the Ministry's Observatory, which has just been launched on the 26th. The Minister signed the order in all of those initiatives the Minister mentioned. So first we have Sofia Miñaño, who's from the National Anti-Fraud Coordination Department of the State Controller's Office, and we're very lucky that she was able to be here with us today. And I'm going to ask her a question to start, which has to do with one of those bullet points Martin mentioned of independent authorities and bodies, so that you can tell us, Sofia, a little bit about the role of the SNCA, the institution you represent, and what its work in the near future will be in developing this strategy. Yes, good morning. First of all, thank you very much for inviting us, for inviting the National Center of Anti-Fraud Coordination, and congratulations for launching this observatory against corruption in the health system. I am here to represent the National Service of Anti-Fraud Coordination, which is a unit which is part of the State Controller's Office in the Ministry of the Treasury. And what do? We are a unit that was created on the basis of a European regulation to cooperate with the OLAF, the European Anti-Fraud Office, in its investigations. As well as partnering with that office, we carry out our own investigations because we have our own whistleblowers channel where you receive a lot of information about potential irregularities or corruption cases connected with European funds. And we're here and our responsibilities are only in the area of protecting financial interests of the European Union, but the national funds are often affected too, because a lot of these projects are co-funded by national or regional funds as well. And we have various functions defined by the general subsidy law, which include identifying any deficits in the systems implemented to manage European funds, launching and directing the national strategies that are designed and implemented, and also communication of any suspicions of fraud or irregularities to the European office. And as for our independence, and here I'm getting off the topic a bit, Jacobo, I'm sorry. As for the institutions that are specialized in fighting fraud, our remit is fraud, although also corruption, because corruption, although strongly connected to the crime of embezzlement, there are a lot of different crimes that are connected with corruption. There's money laundering, there's embezzlement, there's all kinds of economic crimes, but the independence of the bodies that fight corruption or fraud means, of course, that they must be functionally independent. And that means which organizational structure you're part of, the requirements for the appointment of the head of that office, and also any incompatibilities of that head of the office, as well as of any of the members of the office. Another important matter to guarantee independence in this area is to have properly trained personnel and have sufficient resources in order to be able to fulfill the mandate effectively, which, again, is fighting fraud or corruption and taking whatever steps are necessary in that endeavor. In our mission of designing and launching the national strategies, we've already drafted a national anti-fraud strategy in partnership with the OECD, which has given us technical assistance. And in that project, we did a risk assessment and a diagnosis of the situation here in Spain, and we identified some risks, but also some opportunities for improvement, which have then been included in the strategy as strategic goals, which include both objectives and actions, and which are now awaiting approval at the national level so that it can be launched. A lot of different institutions will be involved, not just the ones that manage European funds, but also the judicial police, the Guardia Civil, the National Police Force, the Anti-Corruption Prosecutor's Office, corruption authorities and so on, because this is a very important preventive measure, obviously. And the way we operate, we have an advisory board, which is the advisory board for preventing and fighting fraud, with representatives of different institutions that have responsibilities in all the stages of the process, including investigation all the way to prosecution. And in order to draft the strategy, the advisory board created a committee, which was the one that was more actively involved in drafting the strategy. I hope I've answered your question. I think I've gone on a bit too long. Thank you, Sophia. Very interesting about this advisory board, because the Ministry of Health, of course, can participate in that advisory board and provide support. Giuseppe, perhaps we could take turns.
You, Sophia, in a bit. We are now projecting the framework that that Martin suggested as some way to structure what is a myriad of interventions around transparency and openness. And you gave us already, Sophia, many good examples under each one of these categories. A strong legal framework, structural institutional arrangements in place, anti-corruption bodies, and indeed the observatory. Congratulations, Minister, and all of you for this important development of the Spanish observatory. The whistleblower protection, you were telling me, Jacobo, that you started this initiative in other sectors and you are bringing it to health as well. The conflict of interest regulations, public participation and civil education, something I like to raise later, Dina, because we're not only talking about structural, institutional and governance mechanisms, but the whole point about dealing with corruption is bringing civil society, bringing the professionals. Digitalization and AI. I'm very keen to hear whether AI and digitalization can actually increase that transparency, this accountability, but also detect, screen when corruption is beginning or will take place. Of course, international cooperation, regular audits and meritocratic practices are some of the responses that Martin put on the table. So let me now move to Dave. Dave, already we got many of these strategies that Spain is putting in place. I like very much the approach that the Minister actually already raised and is very much at the core of the Spanish Observatory, which is prevention. Of course, we need to criminalize, we need to punish, crime and punishment, no doubt about that, but we need to prevent it as well. So we know that, and it's been said already, that many of these problems are inherent in the structural and organizational determinants of corruption. So under the transparency, there's this thing about mapping risks, and that's been mentioned already. How do you do that? I mean, can we have some examples of how do you map those risks? How do you get that information?
Thank you, Joseph. There's many ways to do this, and there are many guides and documents to think about this. But I think there's one point I want to make right at the start, is to draw the distinction between the work that my colleague on the left does and in relation to risk and fraud more generally, but also the work that we do in health. And I think the two things are very complementary. And one of the things that we did when we started our work in anti-corruption in WHO was to try to bring together the two communities. So you have a very strong anti-corruption community who work very hard on working on these anti-corruption agencies and these approaches to address corruption, but then you have the health system, and often they don't talk to each other. So I think one of the great things that could be done with this observatory is to encourage participation between the two sectors to better understand what's going on. Turning to your question of risk, I think the question of risk can be attacked at very many different angles. So I just wanted to talk about an issue which is dear to your heart, which is health system assessments. So at WHO, we produce some guidance to think about how you think about corruption areas of risk in health systems. And many of the areas that we talk about are the ones that Martin highlighted in his talk. But then there are other ways to do it too. So we have colleagues in the network that we work on with WHO from UNDP and from UNODC, who have very sophisticated methodologies when it comes to doing risk assessments in health systems. One thing that we did at WHO was to do a patient pathway. We thought about a patient moving their way through the health system and looked at each stage where corruption might impact on that person's health experience, because we're at the heart of it, we're a health agency, and we're really about making sure that people have the resources they need, and we improve health services and improve health. So there are many different ways to do this. It is possible, and I think one last thing I'd like to say is, in doing so, it's also an opportunity to engage with different sectors, because I don't think it's just something that health officials or officials from the Treasury should be doing. I think it's an opportunity to engage with health professionals, with civil society, so collectively you can think about how these issues of risk arise in the Spanish system.
It's a lot of involvement, isn't it?
It's a lot of involvement.
A lot of involvement of,
yes.
Of the different groups.
Yes, because it's not just a technical exercise. I think it's also a trust-building exercise as well. I'll stop there.
Go ahead.
So it's a trust-building exercise as well. I think it's not just something about reports and checklists. It's about changing people's perspectives on this. And I think it's also giving people permission to talk about it. And Martin mentioned in his presentation the importance of talking about corruption.
So it's a matter of process, isn't it?
It's a matter of process.
I'm bringing.
Yes.
You're giving me examples earlier when we're talking about bringing people into a room. Of the various, could you expand on that?
Yeah.
Because I think that's the way.
I think that, yes, so that's a big focus of our work, is bring the people into the room who are affected by this, whether it's the doctors and the nurses or civil society or people from anti-corruption agencies, and talking together about how these things are panning out in the health system. And also to start to talk about solutions. I don't think it's something that you can sit at a desk and work on.
And we want to hear about solutions. Yes. We're all excited about AI. AI is going to resolve everything, you know. So how is AI going to resolve corruption?
Okay.
And physicians, of course.
Okay. So I think there are a lot of digital tools that are already being used to address corruption. So we had an example before of overbilling. And there are definitely technology solutions that can show up red flags in the system. You can see the patterns. If you look at the overall information about billing in health systems, you can see where things are unexpected. So you can use technology and algorithms to identify areas where there are unexpected billing practices. You can also use things like
so there is like an alarm that says,
yes,
hey,
yes, a red flag in the
red
system.
flag, and
yes,
then you can detect what's happening. Do we have that in Spain?
Yeah.
Do we have this system? Could you add on to that? How does that work?
En español, perdón.
Yes, we do. It's the red flags, as our colleague was saying, and that's really one of the main methods that we use for detection. That is, there's a list of situations that have been identified as red flags, and that's part of the list of objectives of the observatory, so that when you detect that, you have to investigate and make sure, to see whether it's actually something, or investigate whether something is actually going on. And, it could be, I don't know. And have you detected a lot of cases this way? Well, it's something that the managers have to do. And if they identify there's corruption, yes, then the red flag is just a warning, which means, or an alert, which means that there's something unusual is happening. And so what you have to do is to check what's actually happening. And if it's not fraud or corruption, that's fine. But if it is, and with AI, this will be simpler. Yes, that is one of the ways in which you're able to filter out and find out whether something's happening. In public procurement, for instance, the price setting or collusion, as it's called, you might be able to identify that there have been a lot of very similar bids or contacts between companies that are bidding. That's both in the detection and the prevention phase, and access to databases is going to be extremely relevant there. Well, yes, we have now. Well, later I will be asking more specific questions of our Spanish representatives, But first, of course, we should talk to Olga Escribano, who's the Director of Integrity Promotion in the Office of, it's an independent office of Procurement, Compliance and Responsibility, which is part of the Ministry of Finance, and she can talk to us about the responsibilities of that office and also the cooperation that's going to be established with the recently created Observatory of the Ministry of Health. Thank you, Jacobo, and thank you for inviting me to be part of this panel. The Independent Office for the Supervision and Regulation of Procurement was also established on the basis of European directive with the aim of establishing independent bodies that will supervise the proper application of public procurement regulations. And as a result of that, with the current public procurement law, our office was established on the basis of Article 132. And the work we do in the office is a supervisory role. It's not a control role. The control deals with a very particular objective, and during the life cycle of that objective, the office supervises all of that activity once the cycle is completed, and it's not based on a particular object, but looking at behavior patterns of different institutions, organizations, procurement bodies, activities of internal and external control bodies. And one of the main requirements of the law for this type of office is, and it's been established in Spain, but of course it's required in all the countries of the European Union, is that they be independent. It doesn't say so many words in the directive, but it does in the Spanish law. And our independence is a bit unusual because we are independent and self-regulated. We cannot receive instructions or orders in our work, nor ask for them, but we are part of functioning of the Ministry of Finance in terms of our human resources and budget and to receive assistance. And our independence is reflected in various aspects. For example, the chair and the 4 members of the board have to be civil servants. They have to have had at least 10 years of demonstrated experience in public procurement. They cannot be removed. They are appointed for a period of 6 years, and they can only be removed for very specific causes, some of which require a prior investigation. So the main responsibilities of the office include guaranteeing proper compliance, monitoring the implementation of good practices in public procurement, also undertaking efforts to promote the principles of transparency and disclosure. As Martin said in his presentation, an important aspect of public procurement has been the issue of the lack of transparency, which always creates mistrust for citizens. In fact, most of the queries having to do with disclosure have to do with this, and they're requesting information in the execution phase of the contract when there's really very little information available in public platforms. Also to make sure of proper compliance and prevent corrupt practices. And in fact, we are, together with Seneca, part of the network of anti-fraud offices and agencies to exchange all of our data and experiences in this field. And I think it might be interesting if the observatory would also become part of this network. In partnership with the observatory, we, as I said, cannot receive or request instructions in the work that we do. Is similar to what happens with external control bodies in the Spanish administration, but we can help other bodies in risk mapping and data mapping. All of our reports are generated, and that's where the possibility of using AI will probably come in, extracting and mining data from platforms, both national and regional. It's a lot of data. The data is very complex, and it's dealt with very differently in the different platforms. And so we do want to resort to AI so we can filter some of this data. And I think it's going to be a very useful tool so that the observatory can also filter data. And another important report produced by our office is the annual supervision report, which meets with the guidelines of the public sector procurement regulations, including corruption control. So we ask the different anti-fraud offices and agencies in Seneca so that we can draw conclusions on procurement of the previous year. And we could also partner with the observatory in the future, once it's up and running, to gather their experience for the following year.
Muchas gracias. Thanks a lot. I think that the point, Dave, that you raised about collaboration between both sectors becomes very clear now. I'll come back to you with more of these preventive measures, such as the contracting mechanism, which I believe that we'll hear more from our Spanish colleagues. But let me move now to Dina Balabánova. She's a professor at the School of Hygiene and Tropical Medicine. She's working very actively in many health systems areas, and in particular in this area of corruption. Dina, we heard from our colleagues already about the citizenship, the involvement, the transparency, and so on. You've been arguing that it's not just bottom-up, it's not only top-down, but also bottom-up. You were talking as well about, in some of your papers, about sometimes corruption almost being part of a accepted social norm. It's almost accepted that there'll be kickbacks, that there'll be corruption. How do we change all that? Could you give us practical, applied strategies where we can involve the citizenship in denouncing that corruption, in whistleblowing, that we can involve the profession itself that is involved, that is part of the process and can help to clean it? Dave was talking about their involvement on mapping risks and so on. What kinds of initiatives we have at our hands to get civil society into this process?
Thank you very much. So it's a real pleasure to talk about this issue, and I think the slide that Martin showed with the solutions, I think the interesting thing is, why don't we hear the voice of the community, of the civil society? Every country we have worked with have a lot of mechanisms, whistleblowing, complaints, lines, everything, but they're not sufficiently used, and we looked into some of that, and you wouldn't be surprised if you know that. Why do you think people don't feed back? Why even people in the health sector? Because very often they don't think anything would change. They don't see opportunity for change. And so I would like to go back to the issue of power. So we've been working with political scientists and thinking, what has to happen to involve civil society, to involve people who are involved in these transactions? How can we facilitate that? And we are thinking, we need to think about the power structures, we need to think about the interest, who is interested. Because one of the sort of propositions we have put across is to work with people, with those people in the system, in the health system and beyond, who are actually interested to eliminate corruption. There are people, even in procurement, there are companies who would like the system to work as planned because they don't want this to happen. There are many doctors where we have facilities in many countries where there is a massive absenteeism, but
so
the doctors...
you go and try to identify those change agents, right?
Change agents. And then what we have done, if you ask me in practical terms, we have done in a number of countries what perhaps similar to what David was describing, consensus building exercise where we would invite different representatives of government, different representatives of professional associations who are also very powerful, self-regulation, invite communities and have this
Do you trust
debate.
the profession to self-regulate?
Not quite. We'll get there. But I think the most important was the dialogue. We had sometimes 3 days meeting and people would not leave. People really want to talk about it. What we said, people want, everybody knows there is corruption. And people are there and saying, what was really interesting, some of the community organizations in communities worldwide where there is a lot of informal payments, a lot of absenteeism, the communities are actually saying what the minister said. We don't want to fire and to punish individuals. They're one of us. They're struggling. They're doing this because this is theirs. They're surviving in this situation.
Dual
sometimes very difficult.
is an example of that, isn't it?
But the
when
point
the
is,
income, as Martin was saying, in the public sector is not high enough, you sometimes can condone dual practice. Or even under-the-table payments. I remember supervising a PhD student, common of both of us, that said, I had to charge under the table because I couldn't feed my family.
absolutely.
Sorry to interrupt.
So I think the most important message we have from our work is that consensus is possible. And even we've had community organizations coming and saying, we don't want punishment. We reported these individuals, but we don't want them to be punished. We want to change the system. We want to make it possible that we come together with a solution. If there are shortages, as you say, can we find a way to overcome this? And I think So what we've been doing, we've been trying to work with different countries to identify what we call islands of integrity. So the question is not why people are corrupt. The question is, in a corrupt system, why some people actually are not corrupt? Why do they follow the rules? We need to almost understand their incentives. So, and if I may, just flag the Lancet Commission on Anti-Corruption, which we would like to launch together with WHO and other key institutions in the field, to really try to understand that what has worked. A lot of the solutions, regulatory, legislative, have not achieved the impact we would think they would do. So even with AI, sometimes you have the data, but they're not used in the system. So the question is, if we have a Lancet Commission, which would allow us to convene people who work on these issues in different settings, and then we can see what works and try to really understand the underlying factors that
When is the
enable
Lancet
good
Commission
practice.
being launched, so we pay attention to that?
This year?
Because I believe you are in charge, together with Dave and others.
Quite a few of us. Yes,
And Martin?
this is something we would like to use as a way to convene different actors to really have a conversation of what works, in what settings, what
Are
can
you
we
involved
do?
in the citizenship, or is all rhetoric? Because we said, just challenging you, because we said that it is the citizenship that needs to be involved on that, not only the professionals. How do we involve the citizenship?
So this is where I think we should not just talk about civil society. We should talk about users. We should talk about you in a health facility and you are facing a practice that you know it's not quite right. How do you actually go back to the health system? Who do you talk to? Who do you trust? And I think we see a lot of this using social media, and I would say working with younger generations and trying to create this trust that something is possible. But I think this happens when we highlight the good examples. People lead by example. People want to see change, and then they get more excited about doing something.
Thank you. Martin, is there any chance for trust? Martin wrote recently for the ministerial conference in Tallinn a major study on trust that we presented to ministers there. It's hopeless, right? Sort of the population don't trust the politicians don't trust the professionals, the population doesn't trust the professionals, no one trusts anybody. Can we regain that trust? Can we regain?
Well, you're clearly referring to some country, maybe one that I know particularly well, but there are countries in which there is
Martin
a high
is from
level
the
of
UK,
trust.
just in case.
I am
He's
not,
not a Spanish,
I am
just in
not
case.
mentioning any countries, Joseph. I'm not mentioning any countries, but take from that what you will. But there are countries in Europe where there's a very high level of trust, actually, so it can be achieved. And I think it's a complex issue. There's a Dutch saying that we quoted quite a lot, which is that trust arrives on a tortoise. In other words, you build it up very slowly, but it leaves on a horse. And in some countries, the horse has bolted, and rebuilding it will be very challenging. But it certainly can be done. And if we look at data on trust around the world, you know, it does vary. But I think the issue of trust in artificial intelligence is an important one. We're doing work on explainable artificial intelligence and diagnosis, but the general principle applies more widely. If you're using artificial intelligence, you need the people who are using it to trust it enough to use it, but not trust it too much when it gets it wrong, that they just allow it to take over. And again, in a country with which I'm familiar, we have an example of where a large number of postmasters, the people who run post offices, were prosecuted wrongly. And they were completely innocent because those in authority trusted the computer system and trusted the data. And this is now unfolding as an absolute scandal of monumental proportions. So we just need to be careful with artificial intelligence. It can do a lot, but don't trust it too much because it depends so much on what you're doing. And the building trust with the community, Dina maybe undersold the work that she and I have done over the years, which is working with communities to find solutions. It's not corruption, but it's about looking at how the health system works. In Kyrgyzstan and Georgia, former Soviet countries, in a clinical trial, randomized controlled trial we did, looking at hypertension management in Colombia and Malaysia, where we worked intensively with local communities to find out what the problems were. And then when we developed an intervention, we got an outstanding result in terms of hypertension control. Now, a slightly different issue, but there's a lot of work that can be done. And often The sad thing is, and I speak as somebody who has played a role in a number of civil society organisations. I chaired the board of the Soros Foundation on Health for many years. I'm a past president of the British Medical Association. But unfortunately, not all civil society organisations necessarily represent the public. So we often need to look at other ways of community development. And if you do that, then often people do realise what needs to be done. Just one comment. The typology of responses I put up, remember, that's only about what governments do. I'm only talking about the role of government here, because we're in a ministry, we're talking to people from a government. If we really want to do this, we need to work with particularly journalists, the Bureau of Investigative Journalists, with public lawyers, the Good Law Project in another country I'm familiar with, with people who have actually used public interest litigation. So there's a whole range of other things that's not on that slide. That is purely the things that governments do. But we can build up trust. We can actually make it happen. And there are countries where there is a high level of trust, but trust has to be earned.
Thank you.
Thank you, Martin.
And now I'm going to ask questions the two Spanish representatives, and you can pass the microphones amongst yourselves. And these are about two or three of the initiatives in the annex of the ministerial order for the establishment of the observatory. And they actually match a lot of the things on Martin's slide, including transparency and strong legal framework. First, about the public procurement law, we need a not-to-do set of guidelines, also to learn from innovative practices in public procurement and in our health system, to work through collaborative procurement practices, to promote centralized procurement. In this context, which ideas do you favor, or which other ideas would you or have you suggested in your own reports? And then as far as transparency, there's things that were also in Martin's slides, like, for example, the activities of lobbies, and we have the intention of, in our department's legislative proposals, to reflect the activities of lobbies, and also to post, for example, a calendar of the ministry's procurement activities. So your views and your suggestions in these areas. Okay, well, as for the procurement, I think I'm going to let Olga answer that, since she's the expert in procurement. But what I could say is that, first, the initiatives that you're planning and proposing, I think, are good, because it's about using the resources that we already have in the public procurement law. What you've mentioned about standard forms and things that can be used to expedite procedures without losing your ability to control and properly monitor execution. But you also need to keep a close eye on the control side of things, because of course you have to pay attention both during the procurement and selection of proposals phase, but also in the award phase, where a lot of things can happen and quite probably no one will hear. So you do need to have systems with red flags, with those alerts you mentioned, to make sure that you will detect issues in those areas which you might have identified in a risk mapping procedure beforehand. Also to have a more holistic perspective, that is not to look at just one irregularity, but about all projects or contracts or contractors that could be involved in particular practices. That's as far as the structure that you need to create with your managers in the ministry. And another thing which became very apparent during the process we followed when we were drafting the anti-fraud strategies, that in Spain everything's very devolved, and so perhaps we lack a more global perspective, and coordination is crucial, because there's lots of data out there, like the one she mentioned, or methodologies and practices for risk assessment and red flag lists and so on, which are already being used in many places, but which need to be shared. And for talking about transparency, I would recommend that we use the existing structures of the Spanish public administration for the Recovery, Transformation and Resilience Plan, because all the transparency part is strongly connected to this ethical culture, code of good practices, and we need to disseminate this and have a platform where we would include all the information, all the examples that you have mentioned are, I think, good ones, and also to have the right governance structures. Ideally, of course, we could use the existing ones for the recovery plan, because you do need to have structures that will make sure that everything we need is being done, including risk assessment, red flag detection, and if cases are detected, the proper actions should be taken. And I'm going to give her the floor because I think I'm going on too long. Yes, and as for potential changes in public procurement practices, in our annual supervisory reports, we do focus very much on the need to reinforce the availability of data in the execution phase of a contract. There's very little information about potential subcontracting. There's very little information about which percentage of the contract that was awarded has been subcontracted out. And that's important because we don't know the volume of subcontracting out of the total of public contracts and its economic percentage. And that's very important. And it's also important to develop the regulations for Article 64, which is about conflicts of interest and corruption. It's regulated by the law. There's a definition of what constitutes a conflict of interest, but we do believe that we need more detailed regulations. And as for publicity and transparency, the problems our managers come across is that there's a huge diversity of information sources, so they need to send the same exact information to a whole range of bodies, and that gives rise to a lot of errors because you're constantly duplicating the information that's being provided repeatedly, and that means that mistakes can be made repeatedly. So we want a single contact point for the manager, and then in contact with the local and regional and central governments, we can organize all that. And as Sophia said, I think in public procurement, we do need to work a lot more on coordination. There's a lot of bodies and institutions that work in public procurement, and we do need more coordination amongst us all. And I think what often happens is that we don't use the work that's already been done, which is already there, and you have to start from scratch on things that have already been done and which you could use. Very useful work done by Seneca with those risk maps, for example, with the recovery and transparency plan, and something in connection with what you were saying before about building trust and involving the public. And in Spain, we are working with Transparency International in open government agreements, and we're working with them on a procurement project, and that's precisely the aim, to make sure we involve not just the administration, but also civil society in something as sensitive as, for example, public procurement, because of this loss of trust which exists in the system. Yes, it is super important. Thank you so much.
Now is ask our colleagues that are monitoring the slide online to give us a sense of what's been said, and then Jacobo, if okay, will ask our colleagues to end up this panel with some short remarks, in which I will add some of my questions at the end to wrap up. Okay? And yours. Please.
Thank you, Josep. We had a couple of questions and comments regarding the role of the regulatory frameworks in combating health system corruptions, a couple of comments on the role of civil society, questions also on how informal payments actually contribute to the unmet need, and then I'll pass over to Matthias for a few more comments.
Thank you so much. Yes, quite interesting input. It's about the political force field and the role of other actors in it. It's about what is civil society's role actually to combat corruption. I think we briefly addressed this with watchdogs. We also addressed it in terms of being part of the risk assessment. And then there was a question, who is actually a possible change agent in all of this? Who can support this? Thank you so much.
Thanks a lot. It shows that our colleagues online are very much following our debate very, very closely. Let's do then one last, please, set of kind of Twitter messages at the very end from each one of you before we go to the concluding panel. Let me now start at this end and then back to Jacobo at that end. Dave, any final reactions on that? And perhaps one particular question from me that I wanted to raise. How can you as WHO support, for instance, the development of these contracts to various member states? And secondly, to you and to Dina, isn't it time for naming and shaming? Isn't it time to benchmark? Isn't it time to show the difference between countries and get audits between countries and be a bit more advocate in this area? I think you have a...
In terms of contracting, I think there's a lot that WHO can do to help countries to strengthen their standard form contracts. I started my career in New Zealand as a lawyer in the health agency. I was there during the 90s when we had the big reform processes, and we moved from funding public bodies to contracting. So I think countries do need more support in this area, and we can certainly do more as a technical agency to support that. When it comes to the measurement of corruption, I'm not convinced that naming and shaming is the right thing to do. But we would like to do, and we'll talk a little bit about this at the very end, is that we do want to help countries to better assess the cost of corruption to their health systems. And I'll pass over to Dina to talk about.
So you agree from the academia as well to the civil service that no naming and shaming?
We like to name, we like to learn from each other. Learning from each other is not shaming. It's, what are my overarching messages? I think health sector corruption cannot be addressed just within the health sector. We need a whole of society approach. Corruption is a problem of the whole society, and also there are deficiencies in the gaps in the health system where corruption thrives, so we could address those. But we can't address this without changing social norms, without empowering people who can do something about it, involving all these actors.
So who's the change agent? That was a question from online. Who is our change agent here?
Everybody. I think it's having the forum for them to talk to each other. I think that's what we don't have in many countries. We have the NGOs and we have the government institutions. How can we create something that not just the civil society, but normal citizens can report and engage with that?
Perfect, thank you. Martin, any last famous words?
Well, as you know, I'm quite happy to name and shame, but I'd rather that people were prosecuted, to be perfectly honest. And I think that what we haven't talked about is the white-collar crime involved in all of this. You know, when we look at the big-ticket corruption, the only reason that people can buy their private jets and their villas in the Mediterranean or wherever is because there is an entire financial services infrastructure, including tax havens and all sorts of other things that allow this to happen. Now, thankfully, we had the Paradise Papers, the Panama Papers and others, but remember that many of the people, in particular in one European country where these people tend to get prosecuted for whistleblowing, for breaching banking secrecy, that allow this to happen. Now, that's not dealing with the small-scale corruption, but we need to remember that the financial services industry has, and the governments that support it by allowing some of their overseas territories to be tax havens and the like, have a very important role to play.
Sí, gracias. Dos preguntas rápidas.
Two questions for a quick answer, just to close. First, with the help that we're going to get from Seneca to identify the risks we face in the Ministry of Health. Obviously, we have to do that risk assessment, but I know that you're going to give us support and training so that we can come up with that risk matrix, which I think the OECD helped you develop as well. And then the whistleblower channels. I think Olga, too, same thing. Whistleblower channels and risk map. Well, yes, the matrix you are referring to, and we will be giving you some training, which you've requested from us. We developed not with the OECD, but following some guidelines that we drafted for anti-fraud measures in the execution of the Recovery and Resilience Plan. And as for the whistleblower channels, the Spanish law 220, 23 was approved, which requires that you establish internal whistleblower channels in the public administration and in private companies with over 50 employees. And then there's an external channel, which is basically the one the law refers to, which is managed by a new authority which is going to be established, which is the Whistleblower Protection Independent Authority, who will be taking the measures to protect those whistleblowers. We have a channel, well, an external channel, which is that of the recovery plan. But the main challenges I see are coordination between that external whistleblower channel and all the other external channels that already exist in many sectors, multiple ones, both for reporting cases between them and to deal with those cases appropriately, but also to protect those whistleblowers. And what's very important is the cooperation with the independent regional authorities to protect whistleblowers, which some of which already exist and did before this new whistleblower law. And it's very important that we define coordination protocols between them. And ultimately, the biggest challenge is to implement those protection measures appropriately in order to achieve the desired goal, which is for fraud and corruption cases to be reported and for everyone to feel secure in doing so, so that people get involved and contribute to the integrity of their organizations and fight corruption from within. Yes, as for the risk map, as a lot of you will know, the National Public Procurement Strategy, which was approved on December 18th, 2022, gives us the mandate to draft the risk map for the Spanish public sector. And so, as a result of our supervision work of these last 5 years, we've identified a series of risks which we're now compiling with some suggestions. We're working on this risk map, which should be ready by the end of November, beginning of December. And as for the independent authority and the whistleblower channels, as Sofia has said, there's many different external channels. We have our own whistleblower channel where we receive reports on potential fraudulent or corrupt practices. Our legal mandate is to open an investigation, and if we identify the possibility of a crime, we need to pass it on to the Anti-Corruption Prosecutor's Office or to the organization responsible for European funds if it is to do with European funds. We've included it in our own internal regulations. We've also included the CNMV when it has to do with insider trading and collusion practices, and that's what we're working on. We haven't established our own whistleblower channel to see what's going to happen yet with the independent authority, because with the law as it stands, we're not very sure of how the authority and ourselves are going to coordinate things. That's something that the anti-fraud offices that are independent of authorities at the regional level also thinking about. So I think I've answered everything with that. Thank you.
Gracias.
Yes, thank you very much. And now I think we need to move on to the closing session, which we are going to hear from Matthias and David, and from the Secretary of State for Justice, Javier Padilla. So thank you very much for your participation.
So, Dave, if you stay in the panel and the rest leave. Matthias will start first with trying to summarize in 5 minutes, short 5 minutes, because we're running late because of my lousy facilitation. I will take them, all of them, and try to give us a sense of what we've been talking about during these minutes. Can you take the...
Thank you so much, Joseph, and thank you so much to all the panelists for this extremely fruitful discussion. There are so many lessons to be taken from, but because I only have 90 seconds, I will focus on two with a view to next step. And the first one I would like to focus, to me, It seems, is it working? Start again. Okay, thank you so much for this extremely fruitful panel discussion. I think there are so many lessons to be learned from it, but I will focus on two because I only have 90 seconds. 90 seconds. And I will also focus on two with a view to the next steps, actually, what can be done and how can we collaborate in the future. The first one, to me, I learned today, effective anti-corruption strategies are intersectoral. It's not just the financial sector, it's also the health system, but there's also a civil society in it, there is the professional associations, there is the users in it, and we need to bring them together. And the observatory would be more than happy to facilitate this a little bit and help. We have quite some experience in intersectoral governance, and actually this year we are bringing social participation to the World Health Assembly, so we have a special issue on this, so we would be more than happy to support this. Second, I heard this, and I think that came from Olga actually, it was very much a focus on transparency, and I think transparency is super important. Of course, domestic transparency, that we know in a country what's happening, but we want to have transparency internationally. We want to compare, we want to benchmark a little bit, we want to learn from each other. What are your problems? How do you respond to it? What are your experience with it? What can we learn from my country? Which is different, of course, but we can still learn. And this is something what we do for a living, actually, isn't it, Joseph? So that is my second thing, transparency. We would be more than happy to do this as comparative health system research and support your efforts to tackle and remedy corruption. Thank you so much.
Thanks, Matthias. That was an excellent summary. Dave, where do we go from here? What are the suggestions from WHO?
It's more of an offer. So there are two things that we're doing at the moment which we'd like to offer to the Spanish Ministry of Health and to the Minister. The first thing that we're doing is we're trying to better understand how to measure corruption and how to measure successful efforts to address it. So in London in June we have a meeting where we're bringing together experts to talk about this. We've produced a white paper about this, and we'd like to invite someone from the Spanish Ministry of Health to attend and take part in that meeting. The second part of that meeting will also discuss the Lancet Commission, so we also have that as an advantage. I also note from the Spanish Observatory that one of the most important aspects of the initiative is collaboration. And in WHO, we host and convene a global network on anti-corruption agencies. And again, we'd like to extend an invitation for Spain or for the Spanish Ministry of Health to participate in that network and to learn from our sister agencies who work on this and to learn from other countries on how to address this terrible problem that we all face.
Thank you. Javier, te han tirado el guante in a number of areas, areas of collaboration.
Pues nada.
Well, first of all, I just want to thank not just the organizers, but I'd also like to thank our interpreters who've been helping us communicate this morning. And of course, we will follow suit, just like we did when we started our term in office, to put this at the center of our initiatives. And I think it's consistent with other policies which we're currently deploying in other areas which might seem unrelated. There's a song by a singer from Uruguay, Jorge Drexler, who says you should love the process more than the outcome. And I think that how you approach it is absolutely crucial. You need to really focus on the processes and the structures, which is what's going to make it possible for you to obtain the right outcome and have good governance. I think tomorrow is the International Nursing Day, and we have an event here on the development of the skills and qualifications of nurses. And just like nurses look after patients, anti-corruption policies look after the system. And I think they're crucial, particularly at three levels. First, because to deal with corruption and fraud gives us legitimacy in whatever actions we take in the future. I think the health policies of a government which has to manage, for example, health emergency, will be much better received by the public when they feel that that government is concerned with making good use of the resources available. Second, because it promotes the commitment of society with its health system in times when sustainability is so difficult. Guaranteeing the sustainability of our system with the full support of society is crucial. And also because to talk about corruption, it's to talk about justice in the broadest sense. I think the talk that Martin gave us was entitled Towards Equity and Efficiency. And when you talk about equity and justice in the health sector, that means two things. It means the justice of bioethical principles, which has a lot to do with efficiency, but also equity, which is connected to how you mete out justice in global terms in our systems. And so these two elements, I think, are essential. And to finish with just a quick example of how we could implement all this in our context, in our ministry's policies, I'd like to talk about something that is essential when you talk about health and corruption. It's a hotspot, let's say, which is everything to do with the drug procurement and the drug administration policy. And we found when we came to this ministry that there were some ongoing law suits connected with the publication of prices of drugs in this country. And so we came across one of the biggest dilemmas you can face as a government, and that's how to be transparent when no one else is in a context of procurement and competitiveness. No one wants to be the only one who's transparent in a context where nobody is, because you get the feeling that's going to put you in the a weaker position when negotiating with the pharmaceutical companies. And I think, of course, the worst thing you can do is to embrace opacity, and that you must move towards transparency whilst preserving, of course, your negotiating power and protecting the rights of the companies for their own business strategies, but conveying to everyone involved, to all stakeholders, the idea that public institutions are not an obstacle to proper access to information, and that the public can have access to that information. So that's one of the things we're working on, and it goes side by side with something else, which is also connected to what Martin was saying earlier, and that's about conflicts of interest. We're currently reforming our drug guarantees law, and one of the things we want to do is to incorporate civil society and the professional organizations to decision-making in connection with the assessment and funding of drugs in the public healthcare system. We need to use conflicts of interest as a tool to align social interests, the interests of the administration, and the needs to participate of the public. So we need to have the ability to facilitate and incentivize the participation of those stakeholders that have the fewest conflicts of interest with the areas that are being assessed. And so that's all. I think that's been an example of how to partner and create networks internally and externally with other parts of our administration, as well as with other countries where there's expertise and knowledge about how to deal with the peculiarities of the health system in these areas. And we are, of course, willing to respond to any requests. We would always like to get on board with any ongoing efforts to implement them in our country. Thank you. Well, thank you very much. That, I think, has been a very useful summary of today's session. And there was one thing that came up several times during the session, and which you've mentioned, Javier, too, which is alignment. The alignment between the different stakeholders, professional organizations, the administration at the different levels. And it's just been an hour and a half, which is not very long, but it's, I think, the beginning. Well, not the beginning, because a lot of work has already been done, but it is the start of a lot of things. This morning when we were having breakfast with Dave and Tina and Martin, we were saying in 2019, when you started working on this topic, what we're doing now would have been unthinkable. And to have Spain leading efforts in this field, and to have the minister be with us here today, and the commitment which you've demonstrated in this area, I think, is a huge step forward. And we have a lot to do, but I think we're moving in the right direction. So thank you very much for hosting us on behalf of the Observatory and the European WHO region, both of which I represent here today, and the WHO, of course, and the ministry, and everyone who's following it online, and our interpreters. Oh, I'm sure I've had a hard job with all these people speaking so fast in English and Spanish, in my case, rather badly in both. Thank you.